very interesting conversation today. An issue and an agenda that is so strategic for the developers at this moment in time. I really want to thank all of you for creating time for this noble conversation and the many convenings and actions that will follow. We've seen a lot of developments within the aid and financing space, specifically within East Africa. We've seen an increase in resources and capital investments within the region, in specific from the philanthropy community. The landscape of philanthropy has equally changed. We've seen new ways of financing being adopted, and the current landscape as it is, there's a lot of focus towards impact financing. The private capital inflows, the domestic revenues which are coming into this region is equally increasing. We are seeing increasing contributions from, the new development partners, the old development partners, which have always enhanced the development work within East Africa. And so the rise in those resources and the ever-growing need for societal transformation calls for us to rethink how we finance, to rethink how we invest within the social context in the region. And so this calls for us to reimagine the models that really focus on financing with an impact lens. So the conversation today really gets deeper into how we can purposefully finance, how we can purposefully invest as philanthropies with a focus on impact. There's also the funding that is coming in and the results which are being seen, the results which are going out. So as investors within the social space and as philanthropic institutions, we really want to see how we can move away from the traditional grant-based programs that have been known to focus on inputs and not results, and really see how we can reposition ourselves to adopt the results out, the focus on impact, the focus on impact. And so these are very critical conversations that we really need to dive deeper into. We really want to also explore today how we can adopt a measurable high impact solutions. What do I mean by this? To strengthen the linkage between the funding that we are talking about that is coming in and the results that we are talking about as results out. Philanthropy really needs to be able to measure the impact of the contributions that we are making. So we are looking at three very critical things: focusing on impact, focusing on results, and really measuring the impact that we are talking about. And so this morning we are joined by a very close partner of EAPN. Now I'm seeing a very interesting comment in the chat. And I am not so sure, colleagues, what to do. Someone is saying, can someone translate in French? That may be a tall order. So Matilda, our programs manager, can you see what you can do about that, even as we proceed? So we have got colleagues of ours from a very close partner of EAPN that we really want to champion this conversation with across the membership of EAPN and outside the membership of EAPN within the partners that we work with. And that is the social finance team that we really want to champion this agenda with within the membership of EAPN and the philanthropy space within East Africa. And so I want to give it over to Phyllis to introduce the team from social finance before she hands it over to Rob, who will start us off today. And I really want to mention at this moment in time that this is the beginning of a very intentional process ahead of us. We may have two series of this being the inaugural one, but then going forward, we really want to come up with very tangible tools, very tangible instruments that can enable us to scale up this conversation and really come up with tangible action steps that can change the way we are doing our financing within the region, including things like, you know, the impact bond. So this is not just a conversation. We are laying a strong foundation for intentional processes and action steps that are lying ahead of us. So we are looking at today as a learning process, just laying that strong ground for you to understand what we want to do ahead of us as we look into developing those tools that will be very important for the investments that we are talking about within the philanthropy space. So Phyllis, over to you, and wishing all of us a productive session ahead. Thank you so much, and all the best. Phyllis.
Thank you. Thank you very much, Evans. It's a pleasure to be here. And already I can see that some of the names are quite familiar. I've been in this sector, development sector, for close to 18 years. And most of those years have been spent here in Kenya. And so I can see a number of familiar names such as Maurice Omondi. So thanks so much, Evans, for having social finance in this call to make a presentation on how we can do development differently. As you've heard, my name is Phyllis Ombonyo, and I'm a partnerships advisor part-time at Social Finance. I've been supporting for the last 10 months. And so today we have lined up a very interesting presentation for you on what you could consider. But before we do that, I think introductions would be so much in order. So I'd like to now hand it over to Chloe to introduce herself, and then hand it over to Rob, who will then give a brief introduction of social finance before we can get into the presentation itself proper. Over to you, Chloe.
Phyllis.
Yeah.
Sorry, before we proceed, I just want to request, for the sake of understanding who is in the room, there's a link that has been used repeatedly by almost 7 different people. That is from Jen Okello. So could you just edit and have your name there so that we are able to know who is with us, and for the sake of subsequent communications. Thank you.
Thank you. Over to you, Chloe. Thanks.
Brilliant. Thanks so much, Phyllis, and thanks so much to Evans for having us. I'm Chloe, so I'm a manager on the international team here at Social Finance, and I've spent quite a lot of my time working on the KNC Development Impact Bond in Cameroon, which I'm looking forward to telling you a little bit more about later, as well as sort of a number of other things, including helping design and scope innovative finance in the development sector, so across a range of different sectors. I'll pass over to Rob, perhaps, to introduce social finance a bit more widely. Thanks so much.
Great. Thanks all, and many thanks, Evans, for the introductions. So just a quick word about social finance. This whole session is not about social finance as an organization. It is about how we better going to focus on the issues, not ourselves. But just very briefly, we are a non-profit advisory organization, and we're focused on all of our work, whether it's in the UK or whether it's internationally, and we've worked extensively across all parts of Africa. It's all focused on how you can better tackle difficult social challenges. Now, obviously, whether it's the UK or in Kenya or many parts of the world, the challenges, the social challenges are large, but the resources are scarce to tackle them. And particularly for those who focus on the SDGs, the Sustainable Development Goals, as well, the SDG target is 2030. So large challenges, not much money, and a short time frame. And in our work, what we try to do is for impact. Then what we do is we work with donors and funders. So I'm assuming on this call, and looking at some of the names coming up, that most people have some connection to philanthropy in one way or another, either on the corporate side, as individuals, family offices, or potentially with donors. And just before we get into any kind of presentations, just to perhaps give a little illustration that when Evans was talking, that made me think about how sometimes things can be funded but aren't impactful. And it's actually an example from here in Kenya. And I'll give a little case study in a while about access to water up in the Asals, up in Turkana specifically, in the arid regions, where working with our partner Oxfam, I'll talk a bit more about that later, the focus on providing access to water. There are lots of donors. These are often governmental bilateral donors, USAID, UK's DFID. In this case, it was a project that was done by the Korean International Development Agency. And I feel bad picking this one out, but it's just an example. And this happens from lots of donors. So there was a construction of a water point, and they'd come in and they'd constructed it, and they'd brought in contractors from Korea, and that was all fine. And it had been recently commissioned, and it looked very nice. It was latest technology, and it was working. The problem was that the contractor had then gone home, and the problem also was that it wasn't clear how to maintain this particular water point. And the last problem really was that all the instructions and the manuals, the technical manuals, were in Korean. And I don't speak Korean or read Korean, and I'm sure probably not many people on this call do. And certainly up in Turkana, there was no one who could read Korean. So it was a lovely example of how there was funding allocated, and with the best of intentions, and something had been built. But in the conditions up in Turkana, unless things are maintained, a water point and all the mechanical workings of the water pump and the borehole, it was only going to last a few months. So this was funding, it was a development intervention, but the chances of impact being sustained over time were kind of zero, because who knows how to read a Korean maintenance? So this is a little example of where funding programs focus on doing things, on activities, on inputs, but not on how do we maintain the impact of this over time. And again, I feel bad focusing on this particular Korean example, but I'm sure in your own work, you've seen multiple examples of how, despite the best of intentions, impact is not sustained over time. And so that's really just in a nutshell what we're going to talk about this morning. So that I think is enough of an introduction in a general sense. I'm just going to, hopefully this works. So Phyllis, can I just ask, can you see the screen now?
Yes, I can.
Great. So what we're going to do for the next about half an hour is to just sort of dive into a bit more of the, I guess, the ideas behind what I've said around how you can actually ensure your financing is linked to impact. And as Social Finance, as a non-profit, we've been working for 15 years now on this problem of how you get better bang for your buck, how you actually get sustained impact from your funding. So Phyllis will lead us off with a bit of a discussion of what can be the shortcomings of the existing ways of working. I'll come back in to talk about some of the ways that Social Finance we've addressed this in a, and then we'll go into some case studies. I think the best thing to do is, Phyllis, is why don't we talk for a bit, and then before we get to the case studies, why don't we pause and just stop for questions, and then we can carry on to case studies, which I think is on the agenda. Evans, please jump in and stop us whenever we are going off track with the agenda. Is there anything else I need to, Evans, perhaps anything else I need to cover before we really get into the substance here, or is that are we all set to carry on?
No, I think for the interest of time, we can get into the substance of the session. So please proceed.
Great. So over to Phyllis. And Phyllis, I'll press the slides and just let me know when to go on.
All right. Thank you so much. You may proceed to the next slide. This diagram here, I'm sure, is familiar with many of us who are in the development sector, involved in various projects. But I also thought that maybe to even drive the point home, I'm going to narrate a story that many of us are familiar with. You will recall in 2011, about 11 years ago, we ran an initiative here in Kenya called Kenyans for Kenya. This was a fundraiser that was started by corporate leaders involving Safaricom, the Kenya Red Cross, in order to respond to the media reports that we are seeing that there was heavy famine in northern Kenya and deaths from starvation in Turkana County that Rob talked about. This particular famine was actually described by the UN as being the worst drought in over half a century. And this left more than 3.5 million Kenyans, 500,000 refugees exposed to starvation and even death. And so it was a really, really bad situation. I recall them mentioning that we had over 300,000 children under the age of 5 who suffered from acute malnutrition. And so the corporate sector mobilized Kenyans to contribute to respond to this crisis. And within a span of 1 month, we raised close to 1 billion shillings, if you can remember. So really a large fundraiser, well responded to, quite emotive, yielded positive results in terms of the resources that were raised. But then when it came to planning, there was, of course, emergency response to provide food aid to those that needed it. But there was also planning on long term, what could we do to address this problem, because it was quite perennial. It's only that in that particular year, things were really bad. And so it happened, but then long story short, we still continue experiencing the same challenges in Turkana as we speak. We have a major problem right now. Just a few days ago, the president requested the CEO of Safaricom again to take a lead, put together a committee and see how we can respond. So I give this example because we also know that there's been a very strong backlash from the public. Like, why did you make us contribute a lot of money and you did not put measures to help address this problem more long term? So that is really an example to drive the problem, the message home of why doing development the way we have been doing is a problem. And so the flowchart you see in front of you demonstrate what actually happens, where we have inputs, which would come in terms of funding from different sources. And then you would sit down and do activities. And this would generally use proven methodologies or approaches with key stakeholders. These activities are meant to yield outputs. And so you think about drilling of boreholes, for instance, of putting up sanitation facilities, of training X number of people. And then it's expected that those activities should lead to outcomes such as more families having safe access to water and sanitation. And eventually the impact would be reduced incidence of water and sanitation related diseases. So this is an example drawn from the water and sanitation sector. Next slide, please. And so that linear approach looks the way we have demonstrated it. And usually the funding comes from the input at the very first stage, where the goal is really to put in as much money as a lot of resources, and in the hope that you will achieve certain results. Next slide, please. And so what is the challenge about this? The problem is that this strategy is on input-based funding. There is, and that's usually miracle is going to occur in terms of impact actually achieved for the communities. Next slide. And so in summary, these are the disadvantages of traditional grant-based programs. I've already, thank you. How are things going and how should we adjust things accordingly? Related to that is the next disadvantage, where there are very high barriers to program adaptation. More often than not, you donors would expect that those that are implementing the program must stick to it the way it was conceptualized. You'd have to go through a lot of bureaucratic process to seek approvals for things to be changed. Next. And so, in short, this contracting tends to favor the status quo. In fact, in those proposals, you are expected to demonstrate your experience in doing this, how you have done it in the past, and how it has worked for you. We don't tend to want to challenge this status quo and do things in a different way that would actually yield. And finally, the other disadvantage with this traditional way of working is that there is very low incentives to think innovatively. So at this point in time, I'd like to hand it over to Rob to take us through the way we can do things differently. Thank you.
Thanks, Phyllis. I just noticed there was some, as colleagues know, I'm not very good technically. There were some strange red lines on the screen. So let's just try and reshare my screen, see if this helps. There we go, I think that's now. Good, thank you, Phyllis. So that's sort of starting us off with the status quo and some of the disadvantages of how funders traditionally work. And as part of the session, it would be good to get participants' own reflections on, so for those who are involved in grant giving, whether any of this characterization of how grants have been traditionally allocated, whether this rings true or not. So let's, I'm looking forward to hearing comments in a discussion. But taking it forward to what we might do a little bit differently. Instead of paying for the activities, so at the kind of the left hand of this flow chart, increasing of paying in, funding an activity, and then spending the focus of time on ensuring that the activities actually happen. Instead, moving down this chain towards the impact, the outcomes and the impact, and instead paying only when those are achieved. So that sounds like a very simple difference. Rather than paying for the inputs, pay for the outputs or the outcomes. But it's quite at a different level, it's quite a radical way of using funding. Essentially, it's only paying if things achieve outputs are measurable and sustained over time. So let's dive into a little some of them you might have heard of, and some of them perhaps not. But results-based financing, results-based funding, outcomes-based financing, slightly more technical terms like impact bonds, which was something Evans mentioned at the beginning. These are all ways of trying to allocate funding only once you've seen results being sustainably achieved. So here's how it might work in practice. Well, here are the basic mechanics. So you'll have a funder and you will have some kind of service provider. It could be a non-profit, it could be an NGO, it could be an enterprise. And in the case studies later, we'll see some examples. But let's say this could be, in the Kenyan context, it could be a social enterprise providing an urban sanitation service, for example. So not a highly commercial or for-profit enterprise, a social enterprise, but an organization working as a business. The funder contracts with that provider. Now, that doesn't mean paying anything up front. Instead, the contract between those two parties will be contingent on the results. So payments will only be made from the funder to this sanitation enterprise, for example, only once results have been delivered. Then, of course, you're probably thinking, like, well, how do you know when they've been delivered? What do you measure, and how do you know it's been achieved? Those are some of the good questions we'll get onto. Then that service provider, of course, is working with its target population on the challenge it's working on, and it's seeking to improve outcomes. So it gets on with its work. And then there is a need for a verification process. And we can talk more about how you can verify that results have indeed been achieved. You know, when should the funder be confident to say, okay, the results that we've contracted for, that we said we would pay contingent on results, and when indeed have they been achieved? So you can have verification by different parties. At that point, number 4, the funder then pays for the results that have been achieved. So, I mean, that's really it. And that's quite, it shouldn't be seen as being particularly complex, but you have a contract, activities then undertaken, and if those activities end up in results, and those results are measured and verified, then the funder pays. That's basic mechanics. In some cases, we'll be running on empty. Where is the funding they need to actually get out into the area they're working? They will need some sort of resources to provide the service that they need, working capital. And some nonprofits or social enterprises may have enough money in the bank, but many won't, particularly if you're trying to achieve results that may take a year or even 2 years to generate and to be verified. So in that situation, you may want to add in an investor. And this is where you would call it an impact bond. So just for simplicity, all an impact bond is where you have that results-based funding, but you add an investor in. So that's the same diagram as before. And you add in an investor. And that investor's job is to provide the working capital to the service provider so that they and then get paid once the results have been achieved. And that's really it. There's nothing particularly rocket science about this. It is intended to be a simple structure. So let's move on a bit to talk about why you might consider funding in this way. So we've talked about some of the disadvantages of a traditional way of funding, of the traditional status quo. And so what might be the rationale for working this way? And I've got 6 elements to consider. The first is around accountability for results, where in a traditionally funded program where a funder is paying for activities, there's no one really held accountable for results that are achieved and sustained over time. Let's take that little example I used of the Korean water point, the water system installed by the Korean Development Agency. The contractor was accountable for delivering the water point, the pumps and the boreholes, but that was the activity. There was no one really accountable for the sustained use, the sustained functioning of that water point into the future. Whereas if you're talking about results-based funding, there is a party that is clearly accountable for that result. So it's much harder to pass the buck and point at somebody else to say, well, you know, that was their job. There's clear accountability for the result over time. A second element in this way of working is that there are clear incentives, and they're quite sharp incentives. And by sharp, I mean, if the service provider doesn't deliver the results that are measurable and verified, then they won't get paid. So the incentive to actually go and do the work properly and to achieve the results is very clear. But they're also not just sharp, they're shared, in that everybody is aligned around the same thing, which is the result everyone has contracted for. As I said, there's a contract at the beginning, which will lay out very clearly the intention is for all of us to achieve whatever it is. So in that case of access to a water point, it may be a water point that functions over time and is shown to consistently operate without breakdown for a certain number of days per year, for example. Or it might be something around the people who have access to that water point. So in the program, everyone's aligned and has the same shared incentives. The third element is this idea that things always go wrong. And as you would know from working in the Kenya context, and it's certainly true in the UK as well, that often when you plan a program, it doesn't take long for things to go off track. And as Phyllis mentioned at the beginning, having a funding program where there's a rigid set of activities and a rigid budget which says you must do the following activities over the following sequence, over the following number of years, and this is what you must do. That gives you no flexibility to adapt your implementation approach to circumstances. Things go wrong. And if the funder is not focused on the day-to-day activities, doesn't pay for those, all they're doing is paying for the results, well, that gives the service provider freedom to flex, to adapt, to iterate, to do things differently. A fourth element to consider around why funding this in this way can be more effective is around data and measurement. Now, as I've said a couple of times, payments are made on the basis of verified results. So that implies that you've got to be really quite thoughtful and quite rigorous about results, which implies measurement, which implies data. And for a program which, even if it was not to meet its results, the emphasis on having a framework for measurement and much more focus on the data is inherently a good thing for understanding why a program is working or not working. And that data can also help you succeed. If you know you're going to be paid on the basis of results, and so you know you've got to be able to measure using data to show you're achieving those results, that data may trigger the payment, may be part of the verification of the result, but it also helps you understand what's going on in your program, which perhaps is really more important, that you may understand that a program is off track. It may help you understand that you need to adapt a particular element of your program to have the results you want. The data may be telling you that things aren't going right. So this way of working forces a much closer, forces much more attention on data and measurement, and that allows you to adapt as you implement it, adaptive implementation. I could never find a better way of describing this fifth one. This is the idea of risk appetite. So here we have, there we go. It's the best image I could find of risk appetite. The idea that there are different types of risk, and different parties are better or worse suited to different types of risk. So traditionally, funders are very risk averse because they have limited funds and they really want to show to their trustees, or if it's an official donor, such as USAID, maybe want to show to their taxpayers back home that they have indeed succeeded. So they're very risk averse. They don't want money to not have impact, or not to be able to show how the money reached the beneficiaries of the program. But that risk aversion can mean this tendency to really tightly manage, and to be very, very specific about activities, and lose the focus on the results. If you can allocate that risk, in that case, a financial risk, if you can allocate it to somebody else, that will free up the program to allow it the flexibility and adaptive implementation I've mentioned. So, for example, you might put that financial risk onto an investor. So the funder doesn't take the risk. An investor has the risk that things won't go well. The investor has the risk that the results may not be achieved. So this way of working allows you to move the risk, to allocate the risk to those who have more of an appetite for risk. And as we know, governments and donors tend to not have much appetite for financial risk, but investors, well, that's exactly what they do. They take on financial risk. So the idea of moving risk around, allocating risk to those who are best placed to take that risk is another element here. And one last one, and if you excuse the picture, I apologize for the picture. The idea that working in this way will usually require novel partnerships. And so it's not often the case that, let's say, a philanthropic investor, an investor who has, thinks as an investor, but has a strong philanthropic intent, so a social impact investor, it's not often the case that they would work closely with either a government or a large international donor. But the kind of structures I've been talking about, are really putting together new partnerships. And that in its own right can be impactful, because you have new people coming together and new ideas being shared, and a requirement to work together in new ways. So this is a set of different elements that would suggest that funding in a results-oriented fashion, financing for impact, could be superior to a traditional activity-based way of funding. Now, I think we're going to just have one last slide here, and then we'll take a pause and have questions, and then go into case studies. So let me just finish this section by talking about when this way of working is useful. The point being that it will come as no surprise to anyone that there are never any silver bullets. This way of working is appropriate in some circumstances, but not all. So it can add value in certain situations. So certain conditions have to be there for this to be a useful way of funding. One is that the problem you're working on is a complex one, but there's a very clear outcome. So you can define, and I talked about shared incentives, that all the partners involved in the program can define and agree what the outcome is they want from tackling this difficult problem. But the problem is a complex one. And the reason I mention that is that there are sometimes relatively simple development challenges which don't need to be funded in this way. And the example I would often use is something like constructing a rural road, which might be the sort of thing that the World Bank or African Development Bank might finance. And in that case, it's a very simple thing. Your output is a road. And the problem you're working on is simply just transport connectivity. And in that case, you would have a clear contract, a technical specification. You would procure a contractor and obviously have someone to check that it's been built properly, but you have a road. It's not a complex problem. The sort of things that we'll be talking about next are much more subtle challenges that may involve lots of different factors and often have a complexity over time. And that kind of problem, where there's a clear outcome sought, but you're not quite sure how to get there, that is the kind of situation where this way of working, this way of funding is most appropriate. There's talking about risk, that the intervention that you have planned is looking promising. Perhaps it's been tried and proven in other geography. Or you've done some pilot work to show that the results look like they can be achieved. But there is still some risk. And the reason I say that is that if you have a program that has zero risk in it, then you can just fund it on a traditional basis. If you have an innovation that's completely untested, well, to be paid only for the results might be too risky. So this way of working is well suited to when there is some risk in the program. I realize that's a slightly subtle point, and we can come back to that. This way of working can be valuable when there's a need for upfront capital, when there's a need for someone to come in and pre-finance the program. And I hinted at this already, the idea that the optimal sequence of steps is not known in advance. So again, you know what the problem is, and you can define that, and you know what the outcome is you want to achieve, and you can define that also, but you're not quite sure exactly which way to go over multiple years to get there. So that means a program where you may, as you go along, have to adapt and iterate and pivot your program. Those kind of programs are particularly well suited to this way of financing for impact. But of course, there are some prerequisites. One is that, as I've said, and hopefully this will now be, you'll have heard this, all these points already, you need, if you're going to pay for results, the results have to be measurable, obviously, but also attributable. And by that I mean, did the result that you are aiming for, was it as a result of the program, or was it a result of something else going on? What would be a good example? A good example might be a program that tries to reduce the incidence of childhood malaria. Now, you can measure the incidence of malaria relatively easily, so the measurability is no problem, but the incidence of malaria is caused by many things, and I will certainly defer to Phyllis and to others who know this topic better than me. The program you may, let's say it was a program to introduce bed nets, that would have had some impact that you could measure, but there are other factors which are much harder to control, such as rainfall. So if it's a wet season versus a wetter season versus a drier season that year, that would also have a contribution to the result. So was your result as a function of what you did, or was something else going on? Well, the attribution of the results to the program is something you have to be quite careful about. So we're starting to get some of the subtleties of when you pay for results. How do you know you've achieved them rather than something else happening? For this way of working, you have to have, probably quite obviously, capacity on the ground to deliver. That should be self-evident. These have to be programs where it is a priority of the donor, the funder, and indeed the government. The idea that a service provider would try and push this way of funding on a program that isn't really the priority of anybody, the priority of a funder, that's not a good place to start. And as I've talked about a bit now, the importance of having data that is reliable and timely. So it's reliable in that you can trust the numbers, but also that this is not data that gets picked up 3 years later in a survey, but is available quickly, potentially even real time in certain situations, so that you can use the data to improve the program, but also to demonstrate the results. So a set of prerequisites that are needed when you are working to pay in this way, when you're paying for results, but then also the ways that can add value. So as I said, this is not a way of funding in all times and in all places, but only in the right circumstances. So I realize if I take a little kind of 2-second break to look at that slide, we're starting to go a level down now into some of the things you would have to think through if you're going to pay results as the way to fund a program. So I think that's probably a good place to pause. I think there was now a section on case studies, and I realized that Phyllis and I have been talking at you for, well, over half an hour, probably too much from me, not enough from Phyllis. So Evans, what would be a good thing now? Shall we pause and ask for questions at this point, or should we go straight into some case studies to make this a little bit real? I'm very aware, particularly that last slide was a little bit abstract, and we really want to make it more tangible and concrete.
Thank you so much, Rob. I am not so sure, but because I have to give direction, I think it would be important for us to get a feel of the case studies, then we can open it up for any comments and questions from the participants. I think that would be great.
Great, good. Okay, so let's do that. And so unless there are any burning questions, let's keep going, and then we'll have plenty of time at the end for questions and answers. All right, so I think, Chloe, we are turning over to you to help turn my slightly abstract waving my hand into something which was real in terms of both how we turned this way of working into something on the ground in practice, but also the results as well. Let's have a look. Right. What I'm going to do then is I forgot the order of the slides, and then I'm going to disappoint you by carrying on talking myself on this Cambodia example, which will be much more fun. I'll just quickly run through this example of an impact bond. So just as a recap, this is a funding program where the funder only paid for results achieved, but another party was the investor. And that meant that they put in funding up front so that the activities could happen, so that the results could then be paid for. And that's what we call an impact bond. And if it should be obvious, that's nothing like for those of you who are familiar with more traditional or commercial finance, an impact bond is not a bond in a conventional sense at all. It is a badly described label for this way of working, funding for results with some upfront working capital for things to happen. So this is, we're moving geographies now to rural Cambodia, where the particular focus of the program was around improving access to affordable and safe and high quality sanitation services for the rural population. The approach here was undertaken by an organization called IDE. So you can see here they are an international non-profit, and their way of working is always to work with markets. So they would call themselves a market-based non-profit. So they themselves are not a business, but they always work with entrepreneurs, particularly micro-entrepreneurs, very small businesses in the countries they work in. And they work across the world, including in Latin America, Africa, and Asia. In this case, this is a program in Cambodia. Now, one thing to bear in mind here is that this program to improve access to rural sanitation in Cambodia was an existing program. In fact, it's been running about 10 years. And they have this market-based approach. They support local businesses, local micro-entrepreneurs to manufacture, sell, and install high-quality, affordable latrines. So there's a nice picture here. So obviously there's bricks and a roof, and that's the superstructure. But underneath the substructure, there is a lot of concrete and sort of masonry work for the functioning of a latrine. The objective of the program that's been running for almost 10 years is to achieve the public health gains of what happens when you have access to safe sanitation, such as this latrine here, this modern latrine, at the community-wide level. So not just individual houses, but what happens when the whole community has access to and uses a latrine. And the point is that produces public health gains over time. In the context of Cambodia, and of course that's, I suspect, very different to rural Kenya, is that there was a very high incidence of open defecation. And of course, that meant the contamination of land, of water in particular, of water sources, and so it had a negative health impact. So the question is, well, if they had an existing program, which seemed to be doing fine, and they were building, they weren't building, they were helping local entrepreneurs to build and sell these latrines, then what was the point of turning to this results-based funding program, this impact bond? And the rationale here was that they already had this high impact program, but it needed to do something different, which was it had already achieved a certain level of saturation. By that I mean they had already found and met the needs of about 2/3 of the population who were are convinced of the need to have a latrine in their compound. So the low-hanging fruit had been met, but they needed to scale the program and meet some specific challenges, which were there was about a third of villages in any given village, on average, were somewhat resistant to paying for and having installed a latrine. They essentially didn't see the need or couldn't afford to move away from open defecation. And so IDE started to adapt their program. So they knew what they wanted to get to. The outcome was very clear. They wanted to achieve more than 90% access to safe sanitation in any given community. But they didn't quite know what they needed to do to their program. They knew they needed something different, and it would be some combination of the way in which they supported these local businesses to sell. So the businesses were good at building these latrines, but weren't as good at selling them, particularly for the customers who were a little bit reluctant. So they had to do something different about the sales side, more closely with local government. So they knew where they wanted to get to, but they weren't quite sure what to do next. And just putting more funding in wasn't going to be the answer. So they decided to have a program where they would be incentivized for the results. And they set a target, which was across multiple provinces in Cambodia, 1,600 villages. And the result wasn't just the number of latrines sold, it was a more ambitious outcome of open defecation-free villages. So it meant that not just individual households, but the entire village, 90% of the entire village had to be moved away from open defecation to having and using latrine. That was the metric that triggered the payment. Payment metric was the entire village in free status. So that was the program, and that was the rationale for trying a new way of funding, so that they would be held accountable for this ambitious metric of not just individual households, but the whole village becoming open defecation free. And this way of funding meant that they could try different things, which is what they did. They introduced various new programs, new sales agents, new people who were on their staff but worked with the local government. They tried various things to see what would help persuade this percentage of the population that hadn't acquired a latrine, unlike the family here, would acquire them to, in fact, would persuade them to acquire a latrine. So just running back to how this works in practice. So you remember the diagram I ran through before. So in this case, we had the funder being USAID, that's the American bilateral aid agency. The implementer here of the program was IDE. Now, IDE is a non-profit, and they were the umbrella for the program. The actual implementation on the ground was done by these micro entrepreneurs. And then the investor in the program is a UK-based foundation called the Stone Family Foundation. So those of you who come from the more kind of corporate foundation side may be familiar with Stone Family Foundation. Stone Family Foundation provided investment. In this case, it's not complex investment product. It's not a complex loan or anything. It's essentially a pre-financing grant. And they provided that in tranches all up front. It was as IDE needed more funding to support the program. IDE then started to implement, and as I said, they don't themselves manufacture or sell anything. Their program essentially is a sanitation marketing program where they support the local entrepreneurs, the local micro entrepreneurs who are the masons who are building and installing these latrines, and they support them with the marketing side to try and build the demand for latrines. So that's what IDE did. In this case, because IDE has a very robust system of measuring results, it didn't need an independent verification. It didn't need an external person to come and literally count latrines in villages. IDE had the data from its program that could show that. That data is passed to USAID, and USAID then pays back the investor. So there's ongoing grant payments, and this is still happening. This program launched This is now the third year. So it launched in 2019. On an ongoing basis, once each batch of villages is declared ODF, open defecation free, and usually it's about 100 villages at a time, then those are batched up together and the evidence is presented to USAID, and then a grant payment is made back to Stone Family Foundation. And that's really it. So that's the mechanism. Payment from the funder only once results are achieved. You have an investor helping with the pre-financing, making a grant up front, but being quite hands-off with what IDE has to do. IDE then is completely focused on helping these local entrepreneurs via its sanitation marketing program and has been free to try new things. This has all happened during the context of COVID as well. And this program has actually managed to stay very much on track because IDE has the freedom to switch things around, to move its own internal budgets, to try new things. And the current, oops, let me just finish on that one, which is that the current program is due to finish at the end of next year and is currently ahead of schedule. The program is ahead of schedule, but they have the data to demonstrate that currently over 1,000 villages have achieved open defecation free status. So it's a live example and quite a nice one that's live. Right, it's time for me to stop talking. I'm going to hand over to Chloe.
Brilliant, thanks, Rob. So yeah, I wanted to talk a little bit about the KMC Development Impact Fund in Cameroon that I mentioned in the introduction. So I guess by way of, in terms of the need for this KMC DIB, Cameroon has a particularly high neonatal mortality rate when compared to both regional and global averages. And every year, around 20,000 newborn babies die in Cameroon, so many of whom are born too early, so they're preterm, or they're born too small, so they have low birth weight. And KMC, or Kangaroo Mother Care, which is the picture you can see on the right-hand side, is an evidence-based WHO recommended health practice for babies who are born too early or too small. And it essentially, many of you might have heard of it, but it essentially consists of providing continuous skin-to-skin contact with the mother and or other caregivers, as well as ensuring, where possible, that the baby receives breast milk as soon as possible. It can offer greater protection against newborn mortality than traditional incubator care, and it's been also demonstrated to reduce infant mortality and morbidity across a whole range of countries. So it's particularly well suited to low resource environments because, unlike traditional neonatal care, you don't need an incubator with a continuous, reliable supply of electricity. And approach has been relatively mainstreamed in a number of contexts. So Colombia is actually the sort of leader in KMC, but it's also practiced to a certain extent in South Africa and Malawi, I think. But it was very, very new in Cameroon at the time of the DIB design, which was around 2018, 2019. And the reason for using an impact bond was sort of what Rob was touching on earlier in terms of the kind of the right amount of uncertainty around the intervention. So KMC had been used effectively in other contexts. It hadn't been used in Cameroon, which has a number of different contextual challenges. But there was sort of the willingness to try and make that work using an impact bond. And so the total size of the impact bond was around $2.5 million, and the program itself lasted 2.5 years. And I guess it's over now, so we know what's worked and what hasn't worked. But there was before I get into the results, the kind of contractual structure, and I won't show a diagram, but just to talk you through it, was that the Ministry of Health of Cameroon, using financing from the Global Financing Facility, so which is part of the World Bank, paid for outcomes alongside Nutrition International, which is a large NGO. And what's interesting about that was it essentially allowed the government of Cameroon to only allocate funding to if the intervention itself had worked, which I think was particularly attractive for them, given that this was a new intervention and they weren't quite sure sort of how effective it would be. It gave them a sense of, or it gave them greater control around how their funding was being used. And then again, pre-financing was provided by GCC, so Grand Challenges Canada, they were the social investor that Rob mentioned earlier. So in terms of what this actually achieved, the KMC as an intervention was brought to 10 different hospitals across all 5 regions of Cameroon. And as part of that, there's infrastructure upgrades that are required, training, and developing standard operating procedures. And all of that then enabled us to reach these quite clear targets. So there was the DIB itself focused on 3 key outcomes, which were having hospitals appropriately equipped to deliver KMC, having making sure that babies were receiving quality KMC, and then also a follow-up check-in. So making sure that when mothers and their babies came back at 40 weeks, the babies had achieved, they were the appropriate weight gain for that point in their development, and they were receiving appropriate nutrition. And overall, the programme, I think it's safe to say, was a success. So we were 28% above target in terms of the number of babies receiving quality KMC. And we also found that 80% of those babies who then came back for the 40-week follow-up had gained the right amount of weight relative to their gestational age. And I think the long-lasting impact of the programme, aside from kind of the rollout of this otherwise new intervention, is the training that took place. So we used a train the trainer model to upskill around 50 clinicians and a number of community health workers as well. In the kind of, now that the programme's ending, there's quite a clear ambition from the government of Cameroon to integrate this into their existing performance-based financing programme that they have. But before, I also wanted to touch on sort of a few of the kind of highlights of innovative finance approaches that were highlighted earlier. So in particular, something that I think was really seen in this programme was the adaptability of it. And the programme ran through COVID, and the intervention itself had to be tweaked quite considerably in quite short timeframes to ensure that we were able to deliver continuous care throughout the pandemic. And I think that flexibility of saying, you know, these are the 3 outcomes, but what we do to get to those outcomes can be tweaked. And we were able to pivot quite quickly, both in COVID and prior to COVID. And I think perhaps an example of that is that we found that in northern regions of Cameroon, which are very remote, we saw that mothers were less likely to come back for a 40-week follow-up because a lot of them are traveling they live very far away from the hospitals. It can be very expensive, and it can be dangerous for them to travel by themselves. So as a result, we were able to think a bit more about sort of community engagement and whether or not they could go to certain checkups at clinics closer to them in order to increase the attendance at that 40 weeks mark. And I think it's these types of, and I think that's really what we mean when we talk about the adaptability and performance-based management, and also the feedback loop element of it as well. I think because you're continuously measuring results, so unlike traditional input-based programming, you don't it's not the intervention happens and then we'll do maybe a midway and an endway evaluation. You're continuously looking at we were running verifications every 3 months. So how many mothers, how many babies are receiving quality KMC, how many hospitals are equipped, and we're able to adapt the intervention as you go rather than at the end. I'll move on to the next one if that's all right then, Rob, and we can come back if there are any questions on that.
There we go.
Thanks. So this next case study is quite different. So it's again a development impact bond called Finance for Jobs that was in West Bank and Gaza, and this is still ongoing. So I guess in terms of the need and the rationale, so there's a very, very high youth unemployment rate in Palestine. So around 40% of young Palestinians are unemployed at the moment. And there also appears to be a skills mismatch, which is really interesting. So there are a lot of qualified young people graduating from universities, but yet employers are often reporting difficulties filling these jobs with the right candidates. And so the DIB itself was the total amount of funding was $5 million, and it launched in 2019. And the ambition is to provide around 1,500 young Palestinians with training and supporting them to find quality jobs that are aligned with their training needs and with their ambitions. I think what's really interesting about this particular case study that I want to highlight is the kind of matching function that it enables. So because it's quite an adaptable approach, you're able to match the labour supply market with demand, particularly in a context like Palestine, where the labour market is constantly evolving. And perhaps a nice example of that is in the initial design, which was done pre-COVID, there were a few areas of employment that were highlighted as particularly promising. So I think at the time it was hospitality and tech were seen as areas with the potential for higher levels of employment. And obviously COVID hit them, and hospitality was no longer as fruitful as we thought it would be. And actually new sectors were emerging, like care and nursing. There was a real shortage of nurses in Palestine at the time. And so the DIB itself was able to very quickly pivot and focus on those high sector areas because, again, we committed to quality jobs as opposed to the training of potential hospitality graduates. And I think that's hopefully another interesting example that illustrates sort of why that ability to focus on outcomes creates this adaptability to achieve then more outcomes as a result. I'll stop there, and I can see hopefully a few questions in the chat.
Yes, let's have a look. I haven't seen that. Why don't we come back to the chat after just one last case study, and everyone's being incredibly patient, and we're talking far too much, but hopefully we are providing lots of food for thought. And the last case study is going to be much closer to home, which is up in the Asals in northern Kenya, specifically up in Turkana. And this is a program, an initiative under development, which we're supporting, but it's really being driven by Turkana County itself and Oxfam. And Oxfam has been present up in Turkana for, I think, over 40 years now. And that itself is part of the problem. And so this case study is around sustaining access to water. So the question, the essay question here is, can paying for outcomes, paying for results, improve the resilience of communities up in Turkana, particularly rural communities, to the effects of climate change? So the issue here is that there is consistently, as droughts hit, a lack of ongoing access to safe, affordable water. And so the objective of the program is to reverse that, is to ensure that there's ongoing access to safe and affordable water for low-income communities, even in times of drought. Now, with the effects of climate change, as Phyllis mentioned at the beginning, the example of the drought for which there was the Kenyans for Kenya appeal back in 2011 was at the time the worst drought on record. But since then, as everyone knows, it's simply got worse in terms of the effects of climate change. But the problem is that the traditional response has been frankly, very short term. And this is partly why I gave the example of the Korean water pump, the Korean water point, so the pump, the borehole, and the system for accessing the water, being an inadequate response. I mean, well-intentioned, but not a response that endures over time. The system and the infrastructure is there, but it's not providing access because it will break down, and there's no system for ensuring it's maintained over time. So the rationale for this, what will probably be some sort of impact on, it'll probably have the results-based funding element we've been talking about, but also have someone coming in to provide some working capital up front. And the rationale for this is essentially investing to save. So what I'm trying to get at here is that when someone comes in and builds a water point, essentially you're potentially wasting money. What happens is that water point is built and then there is no maintenance because manual's in Korean, or there is no one there to follow up and to pay for repairs because things do break down. So the water points break down from lack of maintenance, and so that leads to expensive humanitarian responses such as water trucking. So Turkana County itself, from its very limited budget, pays for a lot of water trucking, as do external donors. And water trucking is life-saving in the moment, but is the perfect example of an unsustainable short-term solution. Instead, if you were to invest not just in the construction of water points, but also in their ongoing rehabilitation if they're broken down, but ongoing maintenance, including preventative maintenance, and not just driving out when they're broken, but having people go out and do regular maintenance every few months so that they continue to work, particularly in times of drought where the intensity of use of a water point becomes that much higher. By investing in that up front, you will save money down the road because you will avoid the need to either go and build a new water point where one's completely broken down, or you'll avoid the need to resort to water trucking, which is very expensive. So the idea of this thing is, if we as a community, partners, funders, NGOs such as Oxfam, but also the county government, as a community come together and say, let's invest up front and commit resources to things like preventative maintenance so that water points are less likely to break down, then we will avoid having to spend money on short-term, expensive, unsustainable interventions such as water trucking. So that's the idea behind sustaining access to water. And I mean, to state the obvious point, there's enough water up in Turkana and the technologies are available. I mean, everyone will have heard of solar water pumps these days, and there are aquifers with sufficient water for the community. So it's not the problem of water per se, it's the problem of sustaining the access to it. So this initiative, the idea is that the outcomes will be robustly measured using data from individual water points around uptime. The idea of uptime being for what percentage of a year is the water point up and running? Is it functioning? And so the idea of a payment being made when the uptime, number of days in a year when it's functioning, is greater than 95%. But also when things do break down, because they will break down, that the repair time is not months, which can be the case these days, because no one's accountable for responding. Everyone else thinks it's someone else's problem. But in this case, there will be contracted service providers whose job it is to respond and repair in less than 3 days. And if these outcomes of a very high percentage uptime of a water point and a very low repair time, if those outcomes are met on the basis of data, you can show that this has been verified from the data, then those results will be paid for. The scale of this program is currently under development, but it's likely to be on the scale of something a bit more than $5 million. So this is a very live example where a new way of organizing the funding and getting everyone organized and focused on the same set of outcomes will try and break that cycle of drought, water points breaking down, and then resorting to expensive water trucking. So this is trying to break the cycle and sustain access to water in a new way, using funding in a new way. So that's a kind of live example from the current situation up in Turkana. Maybe that's a good place to stop. So what I wanted to do was just give one last word, really. We've been talking about impact finance, results-based funding, performance-based finance, and lots of different impact bonds, lots of different words. And hopefully we haven't bamboozled you too much with vocabulary. But what I really want to sort of emphasize at the end is that this is not about funding instruments. It's not about oh, let's do an impact bond because we like the diagram. Think of it really as a way of working, almost as a mentality of partners coming together to focus on the impact that we want to achieve, and always, always working back from the impact rather than starting with the funding instrument. So here's a little diagram of when in our team we had a little survey of when we think about funding instruments, results-based funding instruments, why are we doing them? What's the point? What is the way of working here? And this is what we came up with, a little word cloud of some of the words we've been using today. We're probably inadvertently touched on most of these words today in our presentation: accountability, adaptive management, partnership, data, moving away from outputs, innovation, aligned incentives. This is the reason for working this way. It's not the instrument itself. Think of financing for impact as a way of working, allowing and enabling all these important things, not just as a funding instrument, because ultimately development programs funded by foundations or philanthropists or by governments or by donors, external donors, will need to work in new ways to achieve impact that sustains over time. And these are some of the, for us, some of the key words that we need to enable. So let's stop there. I see that there's been a set of questions coming in. I haven't had a chance to read them. And Evans, I think we're sort of in your hands now as to how you'd like to manage, hopefully, some Q&A. I don't know whether we should start with the chat or whether we want to dive into live questions. Evans, you're the boss here, so we're in your hands.
Now we have got, Rob, we've got a conversation going on within East Africa and of course the entire continent and globe around shifting the power, the decolonization agenda. So there are terms that we are very uncomfortable with, like you are the boss. So as the team leader for now, I think what we can do is balance the two. My colleague Matilda will single out the questions from the chat, so we can start with the general, with the delegates, live questions. Then in between, my colleague Matilda will pose the questions from the chat to you as we proceed. So colleagues, if there's anyone with a question that you want to share with Rob for his input, please feel free as Matilda prepares the first question from the chat. Rob, can I confirm that you heard me? So,
sorry, yes,
all right.
I was.
Then we can pick the first question from the chat, and I see there a question from Whitney, and she's saying, "What happens when the implementer gets stuck? After the first tranche of money, the before the grant money stage." So the question is, how can governments be involved? Or is this private and social sector only? Is there size of an implementer this is for example, $1 billion value of projects or something like that? We can start with that one.
Great, so let me start. These excellent questions. And Chloe and Phyllis, please jump in. Once I get it wrong, you can jump in and correct me. So what happens when the implementer gets stuck? And as I understand the question, we've said that when you're funding for impact or funding for results, that the grant funder only pays once those results have been achieved and verified. And so what happens if the program gets stuck? Well, that's an excellent question. And it depends on your perspective. From the point of view of the funder, if the program gets stuck and isn't achieving the results that everyone hoped for, well, in that context, there are no payments. And from the point of view of the funder, that's means that they haven't wasted money on a program that achieved no results. And this has been seen with these kind of programs. So there was quite a well-known one in the US, and it was focused on, so just to provide a bit of context, in the context of the prison system in New York State, there were high levels of prisoner recidivism, where prisoners were coming out of prison and then going back in quickly because there was a lack of a system to ensure that prisoners got training and support to integrate back into society. And so there was an impact bond with some upfront funding from an investor to address this problem. And the idea was it would be paid for on results of lower levels of prisoner recidivism. And that particular program in New York didn't work. And so the funder did not pay out, and the investor had to take the hit. So they didn't get any return on their investment. So that can happen. The implementer can get stuck. The idea, as Chloe mentioned, is that because there is some upfront funding, the implementer should have room and flexibility to try something else. So we've been talking about adaptive management of programs, and that's just jargon for when you manage a program, do you have room to adapt it as you go, as opposed to being kind of fixed. So this model is supposed to build in room for adaptation, but in some situations the program doesn't work, and the idea is that the grant funder doesn't have to pay, and whoever has provided the upfront funding, because presumably they have some sort of appetite for risk, has taken the risk, but in that particular situation that the program hasn't worked. And that can happen. Second question, can governments be involved? Actually, Chloe, why don't you talk to that? Because some of the programs that we've worked on haven't had government involvement for different reasons. The Cambodia one was working with, as you say, the private and social sector only, but both the Cameroon and the Palestine West Bank example had significant government involvement, right?
Yeah, and also actually another impact one that we mentioned that's under development, which is around adolescent sexual reproductive health in South Africa, also has government as a potential outcome funder. I think, and just to clarify, when I say outcome funder, I mean the person who's providing, or the entity, sorry, who's providing payments for outcomes achieved, so not the social investor, and that does tend to be the more common fit for governments in these types of structures. I think I guess speaking to the two case studies I highlighted earlier, I think what's attractive to governments about this type of funding modality is the de-risking element of it. So as opposed to typical government interventions where they commit to paying for a series of inputs with, I guess, little to no control over the type of outcomes that will generate. In these type of structures, it means that they're able to only pay in the case of success, which I think makes it easier from an accountability perspective to their taxpayers on a very basic level. But also, I think it makes them, I guess what I've seen in Cameroon, and to a certain extent in the West Bank example as well, is that I think it makes them more likely to fund interventions that they perhaps wouldn't have funded, or at least not in the same magnitude, given this de-risking element. And I think we've seen it's easier to commit funding in some instances. I guess the other thing to highlight there is point around sustainability, and I think we've all probably seen externally funded programs and how this can pose challenges when it comes to, when the funding cycle ends, sort of what happens with the program, who owns it, who funds it. And I think having government at the table from the very beginning and throughout the process, at least in the case of Cameroon, has been incredibly valuable, because it means that they've sort of had a ringside seat in seeing the impact, and they have buy-in from the very beginning almost. I would caveat that again with saying it does make the contracting process somewhat more complicated. I'm sure many of you have worked with governments before, and I think it can be, there are a number of procedures and hoops to jump through. But I would say from our perspective, and Rob, feel free to add, I think working with government has always been worthwhile, particularly for that sustainability part, which I think is really, really key.
I completely agree. I mean, you will all be familiar with projects that start and then just stop because the funding runs out. So, you know, having a perspective or a link to sustainability over time is really important. Phyllis, feel free to jump in as well. Obviously, you have a lot of experience working with governments and donors, if you would like.
Thank you. What I wanted to highlight is that the challenges of this structure tripartite partnership is not really unique to just those kinds of partnerships. Many of us have been part of USAID funded projects, and we have been able to see that sometimes these programs get called off midway or even quarterway when resources had been committed, people had been recruited, because along the way, the funder discovers that something went wrong and the results that were expected are not being realized. So I would even say that this other model that we are proposing is less risky in the sense that these results are clearly determined. We know who's going to be responsible, and therefore it becomes so much easier to manage as opposed to just expecting that things are going to turn out in a particular way and not ending up achieving that. But it's great, and I'm grateful that there is a lot of interest. You know, even as we speak, we have a situation here in Kenya right before us. Turkana is happening again, drought. This is something that has been talked about in various circles, including at COP27. And we know a lot of investments have gone in that region for several decades. So perhaps this is a time we started thinking of doing things differently. And I know I'm speaking to some partners here who are involved in the planning of the drought response in Turkana. Identify people who can actually deliver services and be held accountable, and not just putting in investments and hope that we will achieve certain results. Thank you, and back to you.
Yeah, so Rob, there are a couple of questions from Maurice Omondi. I hope you have a pen and a paper. This is quite detailed. He's asking, how does this approach ensure value for money? I'll just take them quickly. He's giving an example of using $5 million to train for 1,500 jobs. What options can be considered? He's also asking around, in the logical framework approach, there are assumptions which ensure critical considerations are taken up, for example, gender and inclusion. And this question is, how best can this approach be employed without only focusing on results, but also looking at what has happened along that chain? He's also asking around, how is the funding or budget of outcomes arrived at? How do we cost the outcome? There are often spillover results which might have been directly or indirectly attributed to an intervention. He's also asking about whether this model can work whether it can work for soft or advocacy type of programs, after acknowledging that it works best for hardware projects. His second last question is around number 2 was around how best can outcome funds credibly commit to paying for outcomes while opening space for other implementing outcomes to adapt and innovate their services, even change design along the way. And his first question was around Maurice, I'm trying to shorten this. Linear practices, we tend to divert focus. That one. All right, I'll synthesize that first one. So you can maybe pick those ones as we look into the other ones.
Okay, good. That's an amazing set of questions. Thank you. These are good challenges as well, so thank you. So why don't we start from, if everyone can see the chat, start from 6 and work back up. Ensuring value for money. That's an example you could talk to from the West Bank. So $500 program, 100 jobs, around funding and the outputs and the outcomes. Do you want to talk to that one, Chloe?
Sure. I guess in terms of, perhaps it's easier to start with how you get to the 5 million, and then we can talk about value for money. I think the process itself takes a number of forms, but I think at a very high level, we typically would identify, so based on the intervention, we would then develop a high level costing of how much we think that would take to cost. And then there are different ways of doing it, but in many instances, we develop a rate card. And I think about how you link to said outcomes. It was the completion of training, a payment for finding a job, and then a payment for 3 and 6 month sustainment of jobs, if I recall correctly. And the price per outcome is then weighted according through a number, that's decided through a number of different factors, but there are different tariffs depending on often the level of complexity of achieving specific steps within that process. And actually, to the point around sort of how gender is included in that, and how I think there was one of the questions was around what about the sort of steps that happen along the way and the assumptions as part of that. So I think these can be quite often integrated into these rate cards. So for instance, on West Bank, in the Palestinian context, there's a specific challenge around opportunities for young women and female employment. And therefore the weighting for female job seekers was slightly higher than that of male job seekers to create that kind of incentive. Rob, I'll hand over to you in case I've missed anything. There's quite a lot in that question.
There is a lot, it's true. So VFM, value for money, traditionally funded activities often focus on that question, because particularly if there are external donors, they want to demonstrate value for money back to their taxpayers back home, which is reasonable. The whole emphasis on, I mean, at one level, only paying for results once they've been verifiably achieved does ensure that every dollar you spend is for a result. So at some level, there is value for money because it reduces the risk of spending on activities that may or may not have any results. But then the kind of related question, I think, is number 4, which is, you know, how do you cost that outcome? How do you know that, okay, you're only paying for the result, that's fine, but the unit of results, whatever it is, obtained and maintained for 2 years, or you know, a water point that is functioning at a high level of functionality for 2 years, whatever the outcome is, how do you cost it? So that even when you're paying for a result, the amount you're paying, then when you're preparing the program, there is often a significant amount of work to understand the costs, actually, which is a lot of the work we will get involved in. So preparing a program that has funding only for results, funding contingent results, requires not only an emphasis on data and measurement, as we talked about, but also on, as you say, understanding costs. So a lot of detailed work to reassure a funder that, fine, they're not going to be involved in the day-to-day management of the project. They'll be quite hands-off and just pay for the results, but to give them assurance that when an outcome is achieved, that the amount they pay for it is a reasonable amount. So it's an important thing to get right. Question 5 on the logical framework. So that flow chart from the beginning, going from inputs, which are funding, activities, outputs, outcomes, and final impact. That's a traditional logical framework. Consideration there, how do we, I think the question is, how do we ensure that some of the slightly more harder to measure elements are critically important, such as gender inclusion, climate, understanding power dynamics, how are those incorporated? So it's a good observation. You can't, or it's quite difficult to measure and manage to those. The concept here is that by having clarity amongst all the partners on what you want to achieve, then when it comes to things like shifting power, it moves away from a donor micromanaging a program and having very heavy oversight and requiring a particular set of activities to be delivered and requiring extensive report writing of what those activities are, and being much more hands-off. And that is part of shifting power away from the funder and shifting the power down to those who are then responsible for a program on the ground, for want of a better word. When it comes to cross-cutting issues such as climate sensitivity, then, or climate, or let's say environmental sensitivity, you would always want to ensure some basic screening or safeguards around any program, however you fund it, that it's not having negative effects on, say, gender elements or climate or environment. Let's take a program which is around water access. Of course, you would want to ensure that there are environmental impact assessments as part of any program. Trying to, where possible, include those elements actually into the outcomes is a really important question. So in climate sensitivity, the program in Turkana is all being driven around climate resilience. So climate sensitivity is the starting point. We're doing some work currently on clean cooking with the Clean Cooking Alliance. And there's a strong focus there on moving away from just programs that fund kind of handing out of clean cook stoves to much more evaluating the impact of those programs on gender impact, particularly around using much more robust measurement of the amount of time saved for women heads of households when they have access to a cook stove, which is much more efficient and hence needs much less fuel and hence requires much less time spent gathering wood fuel or gathering wood fuel or accessing charcoal. So that in that particular program, some of these issues which are traditionally quite kind of mentioned in a log frame, in a logical framework, but aren't actually the focus of the program itself. They can actually be incorporated into the outcomes of the program. So the idea is that you are much more able to focus on these important outcomes, climate, gender, power dynamics, into the program itself, rather than those being things that are mentioned in the program narrative but aren't really being tackled via the funding. Chloe or Phyllis, do you want to add? It's a really important question around these sort of other broader critical considerations. If you want to add on that, it's a subtle but important point.
I did just want to quickly add something around the point around shifting the power, and I think I think these approaches have great potential to facilitate that by agreeing what success looks like and allowing the implementer. So, for instance, in Cameroon, that was a local Cameroonian, relatively small NGO, and they were then had full control over sort of how they got to that outcome. And I think as a result, I mean, I don't know this for sure, having never worked on a traditional input-based program around KMC, but I think as a result, at least their feedback to us was we had much more say and much more control over kind of how we then rolled out that program. So everything from construction and how best to build these specific KMC units to the approaches used in training felt much, their reflection was they felt a shift in power in that respect. So I just wanted to, I think by focusing specifically on outcomes and agreeing what success looks like at the very beginning, I think you can then sort of shift that balance away from donors in terms of the actual implementation in a really interesting way.
Yeah, and that's, yeah, exactly, that's sort of part of what we're trying to get at with this way of working. Phyllis, feel free to jump in if you would like. The third question around hardware versus software. Yes, absolutely. In fact, there's no particular reason why, there's no intrinsic reason why any kind of program can't be reformed or reworked to focus on the outcomes rather than on the activities and the inputs. So, I mean, actually, KMC in Cameroon is a good example, Chloe, of a program that doesn't have much hardware, right? It's not quite advocacy, but it's certainly a sort of a methodology more than hardware, right?
Yeah, I mean, there are there's a certain degree of kind of creating the KMC wards that does require infrastructure upgrades, but other than that, the core of the intervention itself is empowering mothers to be able to give KMC care to their children. So I think it can work really well for those types of programs. And similarly, the intervention I mentioned briefly in South Africa is around convincing school-aged young women and girls to take contraception and encouraging their sort of sexual health seeking practices. I would say it comes back to, I think, the point Rob you mentioned at the very beginning around making sure that the outcomes are attributable to the intervention, which can be slightly more challenging in empowerment programs and a number of other sort of, I guess, softer advocacy-based programs. So I think the binding factor there is how easily attributable to the outcome is this intervention, rather than whether it's hardware-based or more advocacy-based.
Yeah, makes sense. And I mean, in the KMC example in Cameroon, the counterfactual, the alternative that would have happened would have been a program probably had more hardware, right? It would have been an investment in more incubators and probably then standby generators for electricity for those incubators, that sort of thing. And compared to the alternative, this was actually more software in terms of enhancing the capacity of practitioners and medical staff to deliver the program. Is that fair? Yeah. Okay. So yeah, but of course, as I tried to, I was quite careful in my words at the beginning. These ways of working are not for all times and all places. It's only the right circumstances. So the reference to an advocacy program, which in terms of changing the system, whatever the issue is, let's say I take an issue around which may be much more advocacy focused, children's rights, for example. There are certainly programs that need to be much more are best suited to traditional grant funding. An advocacy program might be a good example. So this kind of way of working is in the right time, in the right place. And so we're really careful not to suggest this as a panacea. And there will always be a need for different types of funding for different types of interventions. Okay, so then working back up, question two from Morris was around outcome funds. So where you've got a pot of money to pay for outcomes. Opening the space for adaptation and changing the design along the way. Absolutely, that's precisely what we're trying to get at, which is that you can, by committing to pay for the results, you can then open space for the service provider or the enterprise or whoever it is to adapt and change as they go. That is really and the ability to adapt and change when you're trying to tackle a complex problem is the only way to be successful, because things will, the environment and circumstances will change, and you've got to be able to adapt as you go. That is the point. And then, Maurice, your last question was on transformative language. I completely agree. Language is really important. So if I understand, trying to to move away from linear programs where all the focus is on the donor or the grant giver who makes all the decisions. Yes, absolutely. Again, that's the point. We're trying to. I had a slide I used to use, which was essentially kind of a straight line of the traditional logical framework of a traditionally funded program. I used to be at the World Bank, and I spent a lot of time putting together these very sort of logical programs. You do this, then this will happen, then this will happen, then this will happen, and then we'll get the results. And it was very linear. And the point was, it was completely fictitious, because in reality, life is much more, things go wrong, you go back 3 steps, you try something else. It's much more organic and complex. And trying to find funding models that not only allow for that complexity, but also in a way embrace it and say, yes, we understand this complexity in trying to solve difficult social problems. And our funding facilitates changes of design, iterations, pivots, and reallocations of budgets. And it facilitates that because we're all focused on the end results that we're all looking for. So, Maurice, I don't know whether you want to, if you're still on the call, I don't know whether that's helped at all. Feel free to jump in.
No, thank you very much, very, very much indeed for elaboration on some of the areas. Because sometimes the concern which sometimes arises is that a new concept comes and then it overtakes maybe what was there before, and therefore many donors go into it. So sometimes it is good to just be clear about this approach, and again, even where to find the donors who like to fund in this way, so that it gives the donors options on whether to fund the outcomes or even the processes that go in between. But I really thank you for elaborating on the process about this concept, and also even the discussions that have followed. Thank you very much.
Thank you, Maurice. And on that, let's be frank, there is often a desire from funders to sort of do the latest fashionable thing, and to, these impact bonds, we've heard of these, let's try one of those, that sounds new and exciting. And that's precisely why I put this last slide up. I'll just put it back up again, because it's not about doing the instrument. It's not about saying, let's do results-based funding, let's do an impact bond. That's not the point. The point is, does the way in which you fund enable some of these things in the middle to happen? Partnership, collaboration, accountability for results, etc. This is the way of working. This is the intel inside of a results-based funding program. So it's not about the funding instrument, and it's not about the donor saying, let's try funding this way. It's about trying to create space for ways of working that are going to be more likely to be impactful. So yes, thank you, Maurice. It feels the points you're making are really important. Right, Maurice, do you want, sorry, not Maurice, Evans, back to you. Do you want to pick out another question for us? Or
yes, I'll ask the question. This is Matilda. So Whitney is asking, does this model contribute to donor exhaustion or withdrawal, which in turn threatens program survival? So maybe you could weigh in on that.
Excellent question. So let me give, all our answers are just our own reflections from the programs we've worked on, and also things that we've done in our own past careers. And Phyllis, you can jump in, because you've worked more closely, for example, with USAID than I have. When we helped put together the program in Cambodia that I mentioned around rural sanitation, the USAID embassy in Cambodia said, listen, we're very busy. We think the rural sanitation problem is an important one, but we're busy doing other things. So actually, what we like from this model you're putting in front of us is that we don't have to be very, very hands-on, which I thought was quite refreshing and honest. Often donors are very hands-on and they have funding for their own staff to spend their time breathing down the necks of whoever's running the program. In this case, they said, well, actually, we quite want to be hands-off, and if we can just spend time up front agreeing with everybody what the program results should be and how they'd be measured and what would trigger the payment, and those questions that Morris mentioned around just to spend time getting reassurance for ourselves that this is value for money, that every time we pay for an outcome, it's an appropriate amount of money. Then after that, they've been really quite hands-off. So ideally, this model should almost be the opposite, that less time and money is spent by the donor on administering their programs, because there is effort up front to agree what the results are, and then there's a contract which says they will pay for them. And because it's contracted, the idea then it's much harder just to withdraw halfway through, because there's a legal contract there. And so from that experience I had in Cambodia, there was a donor saying, listen, we like this because it's less likely to exhaust us, because it doesn't require staff here at the embassy spending time supervising activities. We just write a check when you've demonstrated to us results have been achieved. So it's a really good question. In theory, it should lead to less donor exhaustion. And in theory, because there's a legal contract setting out who pays for what, then it's harder for a donor to just withdraw halfway through. So the theory is there should actually be a better way of working with respect to some of those sort of political elements of donor fatigue, donor exhaustion. But I mean, everyone knows that FCDO in the UK is unfortunately a very strong example of a funder withdrawing on commitments and pulling out from things they'd proposed to do and planned to do, and has undermined programs and, as you say, in some cases threatened NGO survival. For the most part, the UK government has worked on traditional activity-based programs and has done very little funding in this results-based way. If only they had done more, then maybe they would be more committed to the program they're supporting. Anyway, that was a personal view. Chloe, Phyllis, please jump in on that. If not, Matilda, what else should we discuss?
Okay, I think
sorry, I meant to say also that so Whitney, if you're still on the call, to make this as two-way as possible, please jump in and push back on my comments or add, or if Whitney has anything else.
Whitney, do you have an additional question? Whitney, you can unmute.
If you like.
Oh, okay, she's written on the chat. She does not have an additional question.
That's a good question.
So, yeah. So, Rob, thank you for all those insights. You've covered most of the questions, or at least areas in which the participants have some curiosity. So if we have anything additional from your end, I'll request that Rob, you summarize, then Phyllis can also summarize, and then Edelston can also summarize.
Okay. Thanks, Matilda. There was a question from Whitney as well. Thank you, Whitney, for the good questions around. So in the Cambodia case, correct, IDE is an international NGO, and so they, yes, as you say, they run on grants. Is it possible to think about this way of working with enterprises? And the answer is yes. So I'll give a personal view, which is if a business is already profitable and serving its customers and regular business, then the only rationale for using scarce grant money or aid money to support them is if they can achieve a social impact, an additional social impact that they wouldn't otherwise achieve from their activities. So personally, I wouldn't want to just subsidize a private company that's already profitable using grant money. That would feel, in terms of value for money, not a very high value use of money. But if you had, let's say, for example, in the Kenya context, I've done, just personally for my own background, a lot of work on off-grid solar access, so access to energy in rural communities. If you could use an incentive payment, a results payment, to encourage a for-profit business to extend its operations to the very remote rural areas where it's much more costly to serve the customer's disposable income because it's a poorer area, and hence if you are a solar lantern provider or a solar PV product provider, you may think, well, the customer's a little bit less attractive to me because they don't have as much money. If you could use the grant money to incentivize those enterprises to really go out and sell their solar lanterns, their solar home systems to communities that they wouldn't otherwise sell to, too far away, too expensive to get there, customer doesn't have enough money. If you can change their behavior using results-based incentives, then sure, that could be a very valid way to work. And in fact, there are situations like that where a solar lantern seller or a solar home systems provider may in fact be the most efficient way of reaching those communities, more so than an NGO, because they already have a business up and running, they already have sales agents, they already have the products. So yes, in the right circumstances, working with a regular for-profit business could be absolutely appropriate way to achieve impact, as long as everyone is very much focused on the impact. And then there's also a category I mentioned of social enterprises where they are, and I mentioned actually it's a sanitation business in Nairobi called Sanergy, who we're working with. So many of you will have heard of Sanergy on the waste containment and collection end of their business, working in the low-income informal settlements. They are a business, but they're very much a social business that it's not yet profitable. So working with a social business or a social enterprise can also be a very effective way of achieving impact. So that's another good question. Thank you, Whitney. Then Whitney had a question around addressing skills gaps. Do you want to just, Whitney, do you just want to elaborate as to what you meant on that one?
Hello, I mean, what are the new skills needed to be able to serve social finance as a sector, as implementers or donors, funders, and especially as
Okay, thank you. If I understood, does that mean what might be needed for service providers, for funders, for donors, even for governments to work in this way? What sort of skills would be needed? Is that the question?
Yes.
Okay, great. Enough talking from me. Chloe, do you want to give an opinion on that?
I guess I can talk probably most of it at the service provider level, and then maybe Rob, you can fill in at the donor level. I think when we're looking at potential service providers for these types of programs, something that's particularly important is the ability to measure what matters in a timely way. So to have the right sort of monitoring and evaluation systems that allow you to measure impact as you go rather than at the end, which is sort of what I touched on earlier. And then more specifically to be able to translate that data into actionable insights. So, and I think this, in my experience, actually requires a bit more of a mindset shift than for away from input-based programs than anything. So it's instead of measuring impact at the end, having the right systems and approach in place so that you can measure impact as you go, and most importantly, adapt program delivery as you go. And I think that's not necessarily something that needs to be present at the get-go, but something that can be built in over time. But I do see that as a pretty key skill needed at the service provider level. And Rob, if you want to talk to the funder level.
Sure. I think the important point here for me is that this is not supposed to be a highly technical way of working. It's more supposed to be around a mindset of focusing on the results and forming partnerships that deliver those results. So I would think of it less in terms of skills gaps and more in terms of learning together. So quite a few of the big institutional donors, like the World Bank, USAID, others, have had some experience of working this way. And for them, it's often a question of the staff involved in a program just being exposed to what their colleagues have done elsewhere and understanding the precedents that have been set and some of the, the internal bureaucracy of a large funder like the World Bank, just to understanding that actually, someone has done this somewhere else. And here's the internal memo that set out how they did it. Okay, I can use that as a precedent for funding this new program in a different way. Some of the skills around costing a program, we talked about, well, how much, if you're going to pay for an outcome, how much should you pay for it? So some of those skills, again, are not new. They're perhaps just there's more focus on them. Putting together a financial model that sets out all the costs is not a new thing. It's not a new skill, but most service providers will have teams who can justify their costs, but perhaps just being a bit more rigorous about it. So I think it's not so much a need for upskilling, but more learning from what others have done. Whitney, you've been a source of excellent questions. Thank you. Similarly with Morris. If there's anybody else who either things we've missed in the chat or other questions. So Chloe, thank you for providing that link. And from Samuel, yes, good question. Well, I can give it kind of an example of that from so the question, if you can see in the chat, is around building consensus between all the parties so that everyone agrees on what the results are and how you measure them so that the thing doesn't fall apart. And that was my photo of the kind of the kitten and the puppy sort of curled up together, unlikely bedfellows in some cases. So just an example of this from the work we did putting together the rural sanitation program in Cambodia. At some points there were disagreements between USAID and the investor in the program, the Stone Family Foundation, who were putting in the money up front. They disagreed about what the results should be. And paradoxically for me, I was quite happy to see that disagreement, as long as everyone stayed at the table. Because what's happened in the past, this traditional way of working, as Morris has pointed out, is that, at least I think I'm interpreting what Morris has said, is that the funder says, right, these are the results, and this is what we're going to fund, and this is what you're going to do. Actually having more of a partnership where you have to agree with others what the results are going to be and how you're going to measure them, actually creates in terms of power dynamics, created a much more frankly, a much more equal process, because traditionally the funder has all the power and the recipient, the service provider, the NGO, whoever it is, has no power. And in your own funding partnerships, you may be quite aware of some of those power dynamics. If, in this example in Cambodia, USAID originally said, well, we want to have, for this funding, something like 2,000 villages. And the investor said, no, no, we've looked at the numbers, and it's not feasible. It's too demanding a program target. And I mean, being in the room, it was interesting that USA didn't like the pushback, and there was some quite frank discussion. But at the end of the day, because there was frank discussion about what was an appropriate result to pay for, and how many villages for the budget, I felt that the program was more robust as a result. So there was some tough discussions up front, but then a program which everyone really agreed on, and I think is more credible as a result, as opposed to a program where the funder says, here's the money, and traditionally the service provider said, well, okay, well, I have no voice in this discussion. So I don't know whether that resonates with your own experience as for some of you as funders, but there is a risk that the partnership won't achieve consensus. And there's a risk of that, sure. But I would rather have a program that doesn't go ahead because there hasn't been agreement on a credible program than a program that does get funded, which is unrealistic and which fails halfway through. So I don't know, Samuel, do you want to comment on that? It feels an important point. Failing up front versus failing halfway through. I have a personal view. I'd rather things failed up front. But Samuel, please jump in.
Thanks so much, Rob, for the nice and very informative discussions that we've had since morning. I think I'm learning this from, I'm putting across this question from an experience that I saw with a particular program. There was, whereby the mechanism of funding is just what we're discussing here. It was resource-based financing. And so the parties involved went ahead and started and initiated the project. But the time frame was around 5 years. But I think hardly 1 year was over before the program was called off, because I think the level of measurement of the results was not in agreement between the three parties, so that you find that at the point of initiation of the project, in as much as they had agreed in this is what is going to be measured, but almost just at the very beginning, that's just a fraction of the 5-year period. There was so much disagreement in terms of what was being posted as results, and I think the whole project fell out, and it was recalled by the funding partner. So I think that is my concern. I see it as a point of there's some high level of risk, of course, in that you committed resources, you really agreed on so many things, you brought stuff on board, and along the way there's lack of consensus and lack of agreement in exactly what you need to post and what you need to measure as results. So that is the concern I'm raising. Thank you so much, Rob.
No, thanks, Emil. Yes, that can happen. I don't have much to comment, but other than emphasizing how important it is for all parties to sit around the table and really think through what they're going to pay for, and to try and get as much consensus as possible on what the result is and how you'll measure it and what will trigger the payments, and just to try and bring that disagreement up front, as it were. But you're right, sometimes programs fall apart. Anything else? I realize we're running low on time. Evans, how are we getting on?
Yeah, we should be headed to the close. I'm not sure. Is there anyone who has got any burning issue that you'd want the team to answer before we bring it to a close? Great. So thank you so much, Rob and the team. I have only 3 things that I wanted to bring out as we wrap up the session of today. Number 1, as a network, we have a responsibility to explore innovative solutions that can really support us in driving a vibrant, impactful, or rather a vibrant, impactful driven philanthropy sector within the East Africa region. And we have been looking into quite a number of areas in terms of exploring alternative financing models. And one of them is the collaboration that we are having today around how we can reposition the sector and its agents around focusing more on impact and results. And today's session was just around how do we understand and appreciate these new models which are there, these innovative solutions which are there. And we've had a good session today as far as my understanding is concerned. And one of the things that this sector has really struggled with is around looking into results and not the inputs, looking at how we can close the feedback loops which have always existed in the traditional ways in which we've done things, issues around program adaptation, removing the barriers which are there, the incentives to innovate. And these are some of the goodies that this model is bringing on the table, helping us really address issues around accountability, which has been a serious threat to buying into the trust of many investment opportunities that we are seeing as a sector. Sharing of incentives, being flexible in the way that we adapt the implementation approach, the conversations around data and measurements, for adaptive implementation. And of course, the whole conversation around risk and how we can better allocate the risk. So this conversation today was just a foundational setting conversation. And Rob, I want you to talk about the second session that we will be hosting. But before you talk about that, what we are looking at as a network going forward is that we have a lot of communities of practice within the network of EAPN and within the sector in East Africa. And we are looking at carrying forward these conversations beyond, the sessions that we are having into developing some practical toolkits around, for example, financing for impact, practically exploring around those communities of practice, what we can really pursue, either jointly as members of those communities of practice or individually as organizations in this call that are interested in this conversation and this alternative innovative financing model that we are discussing today. So Rob, if you could just speak around that second session and just position our thinking around what should we expect from it before we communicate the dates with the participants, rather the delegates, these organizations at a much later time. What do we expect in that second session before we practically move into the tangible explorations that we want to make around this whole conversation? Back to you, Rob.
Thanks, Evans. And I think Phyllis has had to drop off from the call, so I would normally want to bring her in. Anyway, I'll do my best. So, as you said, Evans, this has been a foundational session. The intention has been to present some of the concepts and a few case studies just to trigger some thinking. And a few sort of provocative comments from us to try and trigger some reflection from the group as to how funding can be made more impactful. I think my expectation for the next step would be that for some people on the call, this may not talk to the way they worked, or it may not resonate, and that's totally fine. Hopefully it's been just useful as it is. But hopefully there is also a smaller group here that would like to reflect a bit more deeply on their own programs to date, particularly for those who have some philanthropically funded programs, whether as individuals, family offices, or as corporate foundations, to find a space to reflect more on their own experience. So I realize that we've been talking about some of the case studies and things that we've done, but a space where more reflection on your own experience with funding, and from that to start identifying 1, 2, 3, a small number of specific things that we could perhaps work on together. and that could be an initiative of EAPN, or it could be a smaller group working on something. So the next stage would then be to come back for a smaller group to reflect on this, and much more of a discussion, whereas this has been quite one way. So much more two-way, with the intention of trying to prioritize a few possible areas for focus in the Kenya and, well, I mean, the Kenya and broader East Africa context. I realize that this group is not just focused on Kenya. So that's the suggestion. Evans, how does that sound?
Absolutely. I think that will kick us off for the next engagement that we are having. In brief, we really want to have deeper reflections into the conversation we've had and the opportunities that it's opening for us in addressing some of these challenges that we've had within the philanthropy space, even as we look into the impact conversation. So I want to end it there 6 minutes earlier, and we will, of course, make subsequent communications with the new dates and the practical actionable steps that we are picking from these and how the future looks for us with this conversation. So thank you so much. Expect to hear from us, and a big appreciation to Rob's team. That was amazing, and we look forward to strengthening and, of course, deepening this collaboration as we scale up, of course, the impact that is expected from us in supporting this sector. So thank you so much, and have a great afternoon.
Thanks so much, Evans. Thank you all.
Thank you.
Thanks, everybody.
Bye-bye.